So we're now going to move on to our next poll before moving on to our next panelists. So each one of you in the audience, from your clinical experience, what do you believe to be the critical age that suffers from dentine hypersensitivity the most? So please take your votes. Right, so we're now going to be moving on to our next panelist, who is Donna, and who will give her clinical input on the management of dentine hypersensitivity with her Irish patients. But firstly, Donna, what are your thoughts on the results to this poll?
Yeah, I would say that would be quite, that's what I would think as well. Yeah.
Yeah, I think I'd have to agree as well.
Agree.
Okay, so I know, Donnie, you've been recommending BioMin for a couple of years, and you set up your own website to make it available to your patients whilst in lockdown. So what drove you to set this up when you did?
Well, thank you, and hello everybody. Previous to COVID, in January, February, I was working 6 full clinical days. So during our 2-month lockdown in Ireland from March to May, I had so much time on my hands, I got a little bit creative. I'm very passionate about promoting oral health and visiting the dental hygienist. So I decided to set up a professional Facebook page, other than my own private one, and a website. So patients could gain, look for information, and I had a shop with all the products that I would normally recommend as well. During the first lockdown, when we were all out of our daily routines, we didn't have work to get up, to get ready to go to work. Kids were off school, people were working from home. Even myself, I have to admit that I was sleeping longer in the morning. I took longer to have my breakfast. Some mornings I never got dressed or showered until 11 o'clock, so it just got me thinking it was time to reach out and try to be a dental motivator and get everybody back on track. And so, for the Facebook and the website, this gave me a little platform to try and get the message out there, So that's why I did it.
Brilliant. And how do you communicate dentine hypersensitivity with your patients, Donna?
Well, when a patient comes in and, you maybe start cleaning the teeth and they're squirming in the chair, or they maybe tell you that they have sensitive teeth, beforehand. Obviously, once you've determined why they've got sensitivity, do they have gum recession? Have they got exposed root surfaces? Are they brushing too hard? Have they got toothbrush abrasion? I would show the patient any obvious damage. I would explain the cause and any changes to their hygiene habits, modify their technique, go over that with them. By using a mouth mirror in the clinic, that's what I always do. When I have, a problem that I want to explain to the patient, I always show the mirror, and then we would talk about where their problem is and why they have the problem, obviously. Mm-hmm. Then, obviously, David spoke about the hydrodynamic theory. That's the theory that I always kind of use when I'm trying to explain to the patients. On the BioMin website, there's a picture of the open tubules, which I use. I actually keep that up on the computer on a tab. I think Judith might have my picture there. Yeah, I keep this on my computer, and it's easy then to explain to the patients that the tooth, when it's sensitive, has the open tubules, and with use of the BioMin, the magnified image there shows the exposed root surface, which shows the tubules on the dentine surface. I use this image from the BioMin website, which shows how the bioactive glass fills up and narrows the tubules and then eventually occludes them. This is because the particles are smaller in the BioMin, and it has the binding property as well. I explain that the exposed surface is covered with the bioglass, which will stop any stimuli reaching the nerve endings within the tubules. So basically showing this image, it's self-explanatory. I think the patients understand it really easily, and they accept the problem. Then they accept why they're having pain. They accept that the use of this toothpaste will improve their sensitivity. They can understand how it works then.
Yeah.
So, yeah.
And you briefly mentioned it now, how you explain the benefits of BioMins to your patients. Do you have any examples of case studies of how it has improved patients' oral health?
Yes, I've got quite a lot, but just 2 or 3 from the top of my head. First one, we had a 13-year-old boy who had fixed ortho, who he was quite non-compliant with his oral hygiene, if you want to put it that way. He just wasn't cleaning his teeth. And he was kind of an inherited patient from an orthodontist who sent them to us. He started to show some signs of, hypermineralization round about the brackets, some chalkiness and chalky patches, and they started to kind of flake. So we got quite concerned, and we explained to Mum, look, you'll have to keep these teeth much cleaner. We went over all the cleaning routine with him, but we got him on the BioMin as well, and we reviewed for maybe in about 4 weeks, 3-4 weeks time, we reviewed the boy again, and it was quite interesting because the chalkiness had disappeared. It was much more of a glassier surface. So, I mean, obviously it had remineralized, and we kept him on the BioMin throughout his whole ortho. And luckily, when the ortho was removed, there was no lasting damage to the enamel. So that was one thing that really sticks in my mind. And I've got every patient on with ortho now on BioMin. I just make sure they use it just to be on the safe side. The other one's quite interesting. We had a lady who bought a tube of BioMin. She bought it for herself, and then she also bought one for her friend who was undergoing some chemo, who had a very sore mouth. And I remember the dentist explaining that that would also help with the sore mouth through cancer treatments. And then this same lady who was in hospital phoned the practice and asked if we could send more BioMin to the hospital for her because it really helped. Now, I think the bioactive glass sticks to the soft tissues as well, and it helps to lubricate the mouth. So possibly this was helping to alleviate some of the discomfort in her mouth. Yeah, so these are 2 examples, but there's many more. Most patients just really think it works for their sensitivity, and once they try it, they always want to buy more, so I have no problem trying to explain or once they've tried it, they know it works.
Sure. And just out of interest, Donna, what demographics of patients do you treat predominantly and recommend BioMin for?
Well, actually, I see all demographics. I work in 3 practices. 2 of them are general. One of them is a kind of multi-specialist practice where we see ortho, implants, perio patients. So yeah, I see all demographics, and I would encourage nearly everyone to use BioMin because of the remineralizing action. With the optimal low dose of fluoride delivery over the longer period of time, surely this is a huge advantage in what I personally would want from a toothpaste. Obviously, there's more specific groups that you would definitely recommend it to: patients with sensitivity, patients with hypermineralization, children, poor diets, high, maybe high caries rates, athletes, as David explained there. In Ireland as well, there's quite a lot of people in rural areas that have no fluoride in the water. We have well water in Ireland, and I see this quite a lot. Kids that come in and their enamels it's really poor quality. So we have all the patients in Ireland in our practice that have well water using BioMin. Anybody that needs TLC for their enamel, I think, but it's a great toothpaste, and I use it myself.